AFMC will be noting who is in attendance. You will still qualify for your stipend for attending this virtual meeting. So they'll be keeping track of that. I hope you're ready to hear a lot from Elizabeth Pittman. If you're a fan of Elizabeth Pittman, like I am, she's going to be handling both of the presentations we have for the council today. So a lot of good information that she's going to share. Secretary Putnam said she would be on the call here. I'm not seeing, let's see if she's joined.
I'm on.
Okay, great. Well, without further ado, then we're going to let Secretary Putnam say hello and share some opening remarks. Secretary?
Yes, good morning, everybody. I'll be very brief because we have some great information and you have lots of other folks to hear from today, but I just wanted to say welcome and thank you. I know we've had some new members that I may not have been able to say hello to, but we're very grateful for this group's participation and assistance with input and feedback on all things Medicaid. So we're just grateful to have you all, and the information you all provide is very valuable to us in doing the work and advocating for changes that are needed in Medicaid. So we appreciate you. Thank you so much. And thank you, Jason. Back to you.
All right. Thank you, Secretary. Like I said, we've got a couple of presentations. You're also going to meet the new Division of Developmental Disability Services Director, Jennifer Brzee. We'll meet her halfway through the meeting. If all goes according to schedule, and it may not, we may go longer, we may go shorter. We should be done around 12:20, 12:30. So it'll be a little bit shorter meeting than you're used to. And of course, you'll have to get your own lunch today. But no travel. That's the upside of it. So welcome from all four corners of the state. And if our chairperson, Kristen Arnold, and vice chairperson, Brandy Vaughter, would like to share any opening remarks, feel free at this time.
I just wanted to say thank you for everybody coming today and joining us. And thank you so much and have a great day.
All right, that was Kristen. Brandy?
I was going to say, I'll second that. I am looking forward to especially hearing about the dental changes that are upcoming. I've reviewed those documents, and I'm curious to know. I've got a couple of questions, but I think that we've got some good information coming.
All right. Well, that will be in the second half of the meeting, so stay tuned for that. But let's start off with a discussion on managed care quality strategy. This is something that we as an agency have been looking at, and Director of the Division of Medical Services, Elizabeth Pittman, is going to share with you and with us the details of our updated strategy and the fact that there's a public comment period currently underway. So Elizabeth, take it away.
Yes, thank you, Jason. Do you have the slides or?
You can advance them, or I believe the FMC team has them and they can advance them.
Yes, they can. That'd be great if they can show them.
Okay.
All right. So as one of the CMS requirements, we are required to provide a Medicaid managed care quality strategy. Previously, that has included both dental and PASS, but you'll see this year we took dental out, which we'll talk about in the second half of the meeting. So if we can go to the first slide, please. So what is the quality strategy? As I mentioned, it is required by the managed care regulations, which can be found at that site there. It sets out the goals and objectives of our managed care programs, in this case, the PASS. And it sets out our strategy for meeting those goals and objectives. The quality strategy itself does not give you any new information. It instead is a compilation of all the different authorities over the PASS, the waiver, the contracts, the manual, the program integrity, and the quality metrics that are set out in those, and how we, Okay, sorry guys, my computer decided to sign me out in the middle of this. Gotta love technology. Okay, we're back. And how we plan to meet those. So we have 5 focus areas: access to services. So what is the network? How quickly can you get a service? How long do you have to wait? What is our care coordination and our person-centered service care look like? So as you know, the PASS is a person-centered service plan. It's supposed to be around what the individual members' goals and objectives are, as well as what their needs are as identified by their different assessments. And then outreach. What are the quality metrics that we have in place and how are they meeting those, as well as encounter data, which is claims data from the passes? How are transitions of care going? And what is the program effectiveness and the compliance overall? Next slide. So like I said, we did remove dental managed care because it will not be in managed care when this document goes into effect next year. So dental is in the current version, and we are currently assessing the quality of dental, but we won't be doing that in the future. So we did take it out of here. We did update the program information, try to make it consistent. CMS sent us quite a few questions to try to make sure this written quality strategy was compliant. When we first wrote this, it was our first stab at managed care in the state of Arkansas. And so CMS did have some questions for us that we needed to answer and update the document. It does clarify how we identify those that have long-term care needs or special health care needs, which, as you know, is the majority of clients in the past. And so it does make sure that we identify those needs and address them. It does add information about cultural competency, and it creates a baseline measurement year. So that's just, this is where we're starting. And if we know where we're starting, then we can set goals for where we want to go. Next slide. So how do you read it? You can go to our webpage. It's a very exciting document. It's probably 30 or 40 pages. It does have a lot of compilations of quality metrics and things that are easier to read, but we do encourage you to read it. Check out the link on Facebook or on our website. Definitely take a look at those charts that sort of summarize what we're tracking and how we're tracking it. I find those to be very helpful in seeing where we're going. Provide any comments that you would like after you read the document, and we'll tell you how to do that. We're sending this to all of the major provider organizations, the family and client organizations that we work with, you guys, and then each pass. And then please submit your comments to us by August 14th. You can do that through that email address there, or you can mail them. Again, it's not the most exciting document, but it is very important for ensuring the quality of services that our clients receive. Past clients are some of our more vulnerable clients. They have some of our highest levels of need, and we really want to make sure that the program that we've designed is taking care of them. And that's what this document is designed to do. So please, we encourage you to read it and comment, and happy to take any questions about that.
Any questions for Director Pittman?
All right.
Elizabeth, this seems pretty non-controversial. Is this something that you normally don't expect to see a lot of public comment on, these changes?
That's right. Right, Jason, we don't. This is, like I said, not anything new. It is a summary of things that are already in all the authorities of the passes, but it is really designed to be, this is how we plan to meet the goals of the program. So we do want to hear from you if you have any concerns about that document, but we don't expect it to be very controversial.
Okay. All right. And that probably explains the lack of questions. So you may get some questions in your next presentation. But before we get to that, as I mentioned off the top, we have a new Division of Developmental Disability Services Director. Her name is Jennifer Brzee, and we have the opportunity to have the person she is taking the place of introduce her and maybe interview her a little bit about her qualifications for the job, her interest in the job. So Melissa Weatherton is on the call, and Melissa, I'm just going to hand it over to you, and you can have a chat with your successor if you would.
I'm sorry, Jason. I think she stepped away for just a second. Yes, okay. I think she thought Elizabeth might go a little bit longer, her presentation.
Okay, well, let me ask you then. Tell the Medicaid Client Voice Council members a little bit about your background. They rely a lot on the person in your position. A lot of them are on the waivers, have interest in the developmental services aspects that DHS offers. So tell us a little bit about yourself, your interests, and your background.
Yeah, thanks, Jason. I'm super excited to be here at DHS. I counted it up today. I'm on week 7, so I'm still very new. But as Jason and I have talked about, I've been working alongside DHS for almost 18 years in a variety of ways. Most recently, I was working with the passes. So just like the organizations Elizabeth was just talking about, I helped start the Empower Pass, and then I also helped start the Care Source Pass. So been working in an operational role, clinical, a lot of support with those organizations and helping them get up and running as a pass here in Arkansas. I'm also a licensed clinical social worker, so behavioral health has really been my wheelhouse for a long time. But with the implementation of the passes, I really got to learn a lot about the services that we provide for our individuals with intellectual and developmental disabilities the last several years. And since I've been here, I've been learning a ton about our organization and the staff that we have here supporting those members out in the communities and at our human developmental centers.
And your office is literally a stone's throw away from Melissa's office. So
Yes.
how helpful has she been as you get your feet under you?
Amazing. The staff here, Melissa, Tommy, Regina, Tammy, they've all been super helpful and supportive in getting me up to speed on all the things.
Has there been anything you've learned in your 7 weeks on the job that was surprising to you? Any thing that you didn't expect?
That's actually a good point. I was very surprised to learn about our individuals with intellectual and developmental disabilities who are going into crisis and how hard that is for the team finding proper placements and services to really wrap around these members and support them. A lot of these folks, have had some legal involvement too. And so there's just a lot of complex things surrounding these individuals that I've learned our amazing team deals with on a daily basis.
And Melissa, you know a lot of our former and current council members on a first name basis. They turn to you when they need help. What would you like to tell Jennifer about the Medicaid Client Voice Counselor?
And y'all can still call me, right? I'm just trying to loop Jennifer in more. Like she was saying, we were texting back and forth all weekend because I am grateful that parents reach out to me and tell me what's going on, right? And providers so that we can drive our policies and our programs to make beneficial changes, right? To what's needed out there. So I would just tell Jennifer that, and I think she already knows this, but the advocates in the intellectual and developmental disability space are phenomenal, right? They go out, they fight so hard for their children, they fight so hard for their loved ones. At first, it was a little intimidating, right? Because these many women, it's a lot of really strong women, and they are very articulate and they won't stop, right? Which is what you need in advocacy. So I would just say, get to know everybody on the council, get to know all the parents, and not just the DD side of the house. I see Miss Ledgerwood's on, who's also a fierce advocate, who I consider a friend now. So, advocates are huge allies to us. And they can also sometimes say things that we can't say, right? Out in the public. And they are going to be a huge support to Jennifer, and as they are to me.
So Jennifer, if any of our council members want to get a hold of you or have an issue they'd like to talk to you about, what's the best way to contact you?
Definitely shoot me an email. It's my first name dot my last name at dhs.arkansas.gov, and I'll put it in the chat too. And then I'll put in my office phone, definitely email probably first. And then if I don't respond quickly, please give me a call.
Do any council members have any questions for Jennifer? Keep in mind, she's been on the job for 7 weeks.
It's Brittany Gilmore
Brittany.
here. I have a question. Now, we wouldn't dare ask this of Melissa because she does 9,676 things. But as you step into a new role, do you see maybe possibly going out into some of the rural communities and helping them understand a pass? because as highly concentrated area in Pulaski County, they know there's a lot of outreach and there's a lot of people that allies that you can call and ask for help. Rural communities, we don't have that. I literally currently have somebody in psychosis staying in my shed. That's a different story, but there's no behavioral health places that will take her down here because she's not on a pass. And I mean, people just don't understand that. And I hear that they're good things, but what I know about them, as far as rural communities, I want to throw them in the trash and burn them to the ground. I'm sorry.
Yeah, Brittany, I'd be more than happy to come out and speak to that. I do have like a unique position, having come from the past world and then now in the DHS world. And so I do have a lot of history and knowledge that I would be more than happy to share with anyone that would like to hear that. Please reach out if you have ideas or suggestions about places where that message could be the most impactful.
Okay, thank you.
Any other questions for Jennifer? All right. Elizabeth, would you like to introduce your comfort animal who joined you for this segment?
Yeah, sure. So sorry guys, I had to come home because my AC is out again and the AC guy is coming. And my cat has decided that she's going to help me tell you about dental managed care, and I can't make her stop. So please forgive the 18-year-old cat who pops into the camera occasionally.
All right, so Elizabeth's here to talk about this change in dental coverage that's coming to Arkansas. It's really a change back to the way we used to do it. So Elizabeth, tell us about the reason for the change, what the change means to our beneficiaries. Just bring us up to speed, and then we'll allow for some Q&A.
Absolutely. So you were absolutely right, Jason. This is the way we used to do things. Prior to 2018, we had a 100% fee-for-service dental system. Claims were submitted directly to Arkansas Medicaid. Cat. Okay, Cat's helping again. We're gonna put her down. Okay. Claims were submitted to fee-for-service Medicaid. In 2018, we chose two vendors to start with managed care, Delta Dental of Arkansas and MCNA. And since 2018, we have been providing it through dental managed care. We chose to switch that back this summer after careful consideration. We had initially thought we were going to resume dental managed care. We had put out some contracts for bid. We got bids. We were moving forward in that process. Some things happened in that process that made it seem like those contracts were not going to be viable. So we chose to pull those contracts back. And in making that decision, we looked at several different factors before deciding whether to rebid out dental managed care or move it back in-house to fee-for-service. We looked at what we were doing overall with the Medicaid sustainability plan, and we wanted to make sure we included dental in that and really came up with a comprehensive sustainability approach to Medicaid. We looked at the figures over the history of dental managed care and dental fee-for-service and looked at the overall sort of quality and cost of services being provided, and ultimately decided that the best decision at this time for the program is to pull it in-house and just re-administer it through Medicaid, DMS, and take a look at moving forward comprehensively, either leaving it in fee-for-service or perhaps putting it back out for bid. That decision will be made in the future. But right now, it was really felt like, just given the history of the program and where we were, this was the best decision. So we are now on a very quick time frame to pull it back in-house. The goal is to have it all stood up and ready to go as fee-for-service dental by November 1st of this year. And we are well on our way to making that goal. We have started working with the dental managed care entities to transition clients back over to the fee-for-service world. So what this means for clients is that we will ensure that dental services are covered as they are today. So if you have authorizations in place when we switch it over, those authorizations will be honored by fee-for-service Medicaid. We are working very closely with the dental companies to make sure that happens. We're putting a new vendor in place with fee-for-service to make sure that prior authorizations can still be submitted. But that's the bottom line, is that you will get those dental services covered. We are also working with the dental managed care companies to get all of their claims data to make sure that we have all of that. We're working with providers to ensure the networks stay the same. We've already done our first webinar with providers to educate them on billing and prior authorization processes and what it means to come back into the fee-for-service Medicaid world. We've opened up a client and a provider email address to answer any questions, and we'll be beginning notices to beneficiaries to let them know that starting November 1st, their services will no longer be provided by dental. And I didn't prepare a formal timeline because some of this is still in flux, but the way we are planning on working it is we will stop putting new clients into the dental managed care program on August 15th. That means that the last capitation with new clients for the dental managed care companies will be September 1st. After that date, they won't get any more new clients. So that's the deadline that we're going to start taking clients in-house. But the clients that are already assigned to a dental managed care company will stay with that company through the November 1st deadline. And that's just so that we're not continuing to put new people in that will only receive that care for a small amount of time. We want to avoid disruption in services as much as possible for clients coming in. And so that's the timeline. We'll send out communications to that. And once we switch over and you're in fee-for-service dental, you just use your regular Medicaid card to get your dental services. All the dental providers that are in network with the two dental carriers are going to be in network with fee-for-service. They're already enrolled with us, so you don't have to switch dentists. So that is the very short time frame. And I'm happy to take any questions. I know you have a ton.
All right, so first come, first serve. If you have questions for Elizabeth on this change, what's coming, feel free to ask. Go ahead, Angelica.
Hi, I have a question. Good
Yes,
morning,
ma'am.
Elizabeth.
morning.
So I was reading over the agenda item
Mhm.
and I saw that so the services that are typically offered are still going to be offered under the fee-for-service, which I was surprised to see some restorative services in there,
Mhm.
specifically crowns, root canals, because this is something under my understanding that is currently not covered through the managed care. And I was wondering, are we going to have additional benefits now?
So for November 1st, we are not changing any of the benefits or anything like that. We're just trying to transition the program back. The current dental managed care program does cover crowns and dentures and things of that nature, as does the fee-for-service program. There is no limit for children's benefits, so they can get all the dental services they need. For adults, there is a $500 limit right now, and that is a hard limit in the dental managed care organization. So we are looking at that for the fee-for-service and determining what authority we may have to make that a little more flexible. And then, of course, after November 1st, once we get this going live, we'll look at the entire service package and make some determinations about the best course of action for the program going forward. Does that answer the question?
I couldn't hear anything you said because
Oh, no.
I didn't have any connection.
I understand. That's happened to me a couple of times already. So I was saying that we do currently cover crowns and dentures in the dental managed care program, and in fee-for-service dental. Those are a benefit. Right now, there's no limit for children. They get all the dental services that they need. And then for adults, there's a $500 limit. Under the managed care program, that's a hard limit. So they can't go over that $500. When we move to fee-for-service, we're going to leave everything in place as is, because our goal with the tight time frame is just to get it transitioned. But we're going to look at that benefit package as we move that over and determine if we need to make any changes to it.
I would really, really love to talk to you more because I've been trying to get a crown for years now.
Okay.
And I've been told that that Medicaid does not cover any restorative services.
I would love to know who's telling you that.
Same.
I would love to tell you. Yes,
Okay.
I would
Let's talk.
really love to talk because I've been having like medical issues, like infections due to my, teeth not getting treated, and like it's caused so much pain, and I haven't gotten anywhere.
Okay.
So I would
yes.
really like to discuss.
I just put my email in the chat. Just give me an email and we'll
Okay.
either set up a time to talk or we can communicate via email or whatever works best for you.
Okay, thank you.
Any other questions for Elizabeth about this upcoming change in dental care coverage?
Yes,
Go ahead, Erica.
thanks. Hi, Elizabeth. Erica Grazer here.
Hello.
My question, you answered half of it. My main question for you, I know that first off, getting everybody settled in is going to be priority.
Mhm.
After that, will you all be looking at raising that 500? And the reason I ask is the 500 right now I'm in Northwest Arkansas. So once you go into your dentist, you get your x-rays, there's your 500. You can't even get a cleaning. You've already used your 500. So your cleaning is out of pocket. And I have had a prior auth done, which you also stated you guys will still be doing prior auth if as needed. But will you all be looking at raising that limit at all once you get settled in? And obviously I get all of that, trust me.
Yes, ma'am. Yes, our intention is to look at the entire benefit package after we move it over.
And
So,
and same thing, I've been told no, you cannot get, Medicaid doesn't cover crowns, doesn't cover all of these things for adults.
So I don't know that it's that we don't cover them so much as there's a hard limit.
Right.
Yeah.
So that was just an FYI, but yeah. So after you get everybody, that was my main question is, are you going to be looking at raising that? Because paying out of pocket for a cleaning when you are on SSDI is not really easy. Every dollar counts every single month. So that was my main question for you after that. So thank you.
You're welcome.
So that's two people who were under the impression that Medicaid didn't cover crowns or things. Is that some bad messaging out there on that point, or where do you think that's coming from?
Crowns, root canals, all of that.
I can kind of jump in with maybe some clarification on that, because I've had several senior adults that are on Medicaid that I have been dealing with dental offices, and it's not that it's not covered. It's exactly what Elizabeth said. It far exceeds that $500 hard limit that they know. So they know that they cannot, or the way it was explained to me was they cannot use that $500 limit toward the crown or that procedure, because that procedure exceeds that $500 limit. So they prefer to use that $500 limit for preventative services like teeth cleanings, x-rays, those things that's considered to be routine dental care for adults. But because the crowns and things far exceed the $500, it's just easier for them to explain to the patient that it's just not covered. And it's really, they shouldn't say that. They should say it's not enough coverage is the way that they should word that. But that is something I would definitely like to see you visit when you're looking at budgeting that, because there's a lot of insurances that are out there that cover the routine things. I mean, everybody needs a teeth cleaning at least once a year. So if that could be considered as part of a benefit and not be using in that $500 and leaving that $500 for things that are, more incidental, like crowns or root canals or things like that, but at least covering a routine x-ray and a routine dental cleaning once every 12 months for an adult, I think you might see your benefits, or I would think you would see benefits be better utilized, because they would not be they'd be catching things early on if they were able to go once a year for a teeth cleaning. Whereas right now, most people are just not going at all because they know there's not enough money to cover, and they can't cover the out-of-pocket expenses.
Yes, ma'am.
Thank you for those thoughts. I wrote them down.
Randy, did you also have a question for Elizabeth?
No, that was pretty much it. She had answered it with when in discussing that $500. As I said, that's been my issue with patients all along is they can either get a teeth cleaning or they can get an x-ray, but they can't get both.
I see.
Then they've exceeded that maximum. And then any other, like I said, any other additional procedure that might be needed is just not covered any longer or doesn't have any benefits left to be covered.
And Elizabeth, where did that limit come from? Was that something the managed care entities came up with, or?
No, that is an old fee for service limit. And it was written into the managed care program as a hard limit, and their rates are based on it.
So to raise that, would it require legislative approval?
It would require us to take a rule. So that would require legislative approval, but not a statutory change.
Okay. Any other questions on this topic for Elizabeth, council members?
I have another question, Jason, a
Okay.
follow-up question. I'm so glad that 500 limit was explained because, that makes a lot of sense now. As to why I've been given that blanket statement of, restorative services aren't covered. And I was wondering if there is a medical necessity, like if someone medically needs this dental treatment because they're having, it's causing medical issues where, I'm going to the urgent care for, infections in my teeth, jaw infections. Currently, I have 2 ear infections. Would there be a way that this can be changed so that the limit could be increased for people that medically need these dental treatments? Could that be looked into? Or maybe like,
We are
if you have
looking at, yes, ma'am. We're looking at many options, including having what we call an extension of benefits, which would leave the limit in place, but would allow people to, like you're saying, request it to be extended in cases of medical necessity. I wrote down the idea of exempting preventative. So we're looking at a lot of different options for how to, make sure the dental program is solid and improved as we pull it back in-house. I mean, we really consider this a good opportunity to take a comprehensive look at the whole program. So any ideas, we'd love to have them in writing so that we can consider them as we move forward. But that's one of the things we're looking at.
That would be awesome.
Any other questions? All right, thank you, Elizabeth, for not only that, but your initial presentation as well. Now, the first presentation went pretty quickly. There weren't any questions. Elizabeth covered ground pretty quickly. So we're running ahead of schedule. I want to thank the other DHS leadership who are on the call, in addition to Secretary Putnam, and now is their chance to answer any open questions. It's our open discussion time we close all of our meetings with. So if any of you have questions on topics unrelated to what we've discussed so far, but related to Medicaid, now is your chance to ask those questions.
Do we have any updates on the portal changes that we were talking about that would be forthcoming this fall?
Say that again, Brandy, and get a little closer to your microphone.
We're looking for an update on the portal access changes we talked about.
I think Mary can handle that one.
Hi, I didn't actually look up like planned dates. I know some of the things we talked about were already like on our roadmap and planned. I just did not look up those dates before the meeting. I can check into it and then send Jason an email to send you guys out. There was one change in particular related to authorized representatives and how they get copies of notices and things that we did not yet have scheduled into a release, but it is still on our list, and we do plan to make that improvement to the portal. So sorry, I don't have specifics, but we have not forgotten, and we do plan to make those updates.
When we discussed those changes at that last meeting, was one of the items also going to be the ability to actually submit the waiver applications online through the portal, or having an online application that can be completed like the SNAP and some of those other applications that are there already?
Yeah, I remember that was one that we had asked about.
Okay, well, no, you can already submit an application. We have an integrated application that's for all programs. So I'm wondering, was it about an application or some of the other supporting forms maybe that you were asking about? You'll have to refresh my memory.
I have not been able to find that uh, application that you're referring to in regards to like assisted living facilities.
Oh,
It's
yes,
not
but
giving me that option.
it's the same application. If you
Okay.
click, when you go to Access Arkansas, if you click healthcare, you can apply for any of the healthcare categories. And in the specialty categories like TEFRA, assisted living, there's a place that you can mark a box that I'm specifically interested in this, but we're going to assess you across the categories regardless, but it does help us to know if you need assisted living. So that's already there.
And Mary, on that, so it's just specifically to that question about assisted living, it's called the Living Choices program. And so, I mean, it's very close, but it doesn't specifically say assisted living. It is the Living Choices waiver program that we operate for that space. And if you read the captions out next to those, each of those titles, such as AR choices for home and community-based services, living choices for the ALF waivers, that's where you'll find that on that front page of the application.
Any other questions for any of our DHS leadership from our council?
Do we have any updates about mental health care?
Specifically,
I know that there has been some, like there's some ARPA stuff going on that's going to allow for some, like, I guess, special pilots of programming, and also just some changes that Secretary Putnam was going to be implementing. And I just don't know where we're at with that.
Hey, Brittany.
Hello.
Hey. So yeah, we put that roadmap out. I don't know if you had a chance to read it. It is kind of lengthy, but
that's kind of what I was talking about. That's kind of the questions I was asking.
Yeah, absolutely. So yeah, we're doing like 23 initiatives, I think, under American Rescue Plan funding, between what the federal government gave state Medicaid offices and then what the governor and the legislature graciously gave us, right? So we've put out the grant applications and have not officially awarded yet because the grants themselves have to go through legislative review the week of the 19th, but really hoping we can do some really cool stuff with the governor's office around a press release because they're really excited about it too. So all of the money that's going to go towards, or a large portion of the money that's going to go towards renovation and construction for those programs we needed. And then we pushing through some other grants in September as well, because we're under a really short time frame. So a lot of this money has to be obligated by the end of this year. And then another funding source has to be spent by the end of March next year. So we're just feverishly trying to get everything in place. But you will be seeing a grant go through for our statewide crisis hub. We're going to be piloting that in 4 areas of the state. It'll be starting to be built early next year. So a lot going on. I didn't know if do you have a specific question about one of them? Because, I can talk about art for the next 8 hours. Nobody wants that.
Right. Well, hey, I do. Okay. So but anyways, no, that's just kind of, I guess, my overview. Looking at that roadmap, like I said, it's a plan that's going over the next 2 years. So I just didn't know exactly where we were in that process. So that was just kind of my questions asking.
Okay. Yeah. I think right now trying to get all the grants out the door, locked in place, right? So we can start building all these programs. We're making a lot of movement on those prevention programs that the University of Arkansas is building. And then the other program, that family-centered treatment.
I do have a question about that. Hold on.
Okay.
I don't want to call it the wrong thing, but I had somebody ask me yesterday and I said that I was gonna be on here today, and it would definitely be whenever I'd figure out some more information in regards to it. It is a pilot program that's happening. It's not in both of our schools in Sevier County, but it has been it is in one of our schools. It family transition partner. Is that it?
Yeah, so it's called the so I got my roadmap. So hey, it's on page 21 of the roadmap, and it's the program that U of A is building called Prevention, Stabilization, and Support for Young Children, and it's the one that's in schools. And so I know Sevier County is one of their pilot locations.
Yeah, but they didn't give it to the Queen. They just gave it to Horatio. Do we know why that is? I had a school official ask me that, so
just because it's pilots, limited money, limited resources, right?
So we did the smaller school district.
Yep.
Do we foresee that being able to be spread across the county?
That's the goal.
Yeah. And how long is that set to take? Do we know? Do we have a timeline?
We do. So here's where we are on that, just to be frank. So that money for ARP 9817, which is what we're building those with, has to be spent by the end of March, right? So we've been having calls with CMS because this is what keeps Paul and I up at night is we have to, amongst other things, we have to have federal approval because we need these to keep going. And we want to keep being able to pilot them because the pilot time has been so short that we want to make sure they work. I mean, that's the whole reason for a pilot, right? So we want to make sure what we're doing is working. If not, we tweak it. And then we need to see fiscal impact. I mean, because we always have to be mindful of state taxpayer dollars, right? So we've also got to get a good handle on what would this cost to spread across the state. So what we're asking for with the feds is permission and approval to continue our pilots for one more year. So from April of 25 to April of 26, right? And so that's what we're working on right now is we would stay in the same areas. We keep seeing what works, what doesn't work, so that we have a good product that we all feel comfortable saying, yeah, this is awesome. We want to move forward and do this statewide. So that's the goal.
Okay. Thank you so much.
You're welcome.
And Brittany, I can't answer why Horatio over DeQueen, but I know that they wanted school districts of different sizes. Like Batesville is one of the 5 pilots and they're a larger district, and Horatio maybe was one of the examples of a smaller district they wanted to use, but they just wanted different areas of the state, different size schools so that they could run these pilot programs with, different demographics.
Yeah, I think Melissa answered that question for me. It was just the Queen School District is way bigger and extremely diverse with a huge Marshall Lee population. And we have not even started to tackle that monster, unfortunately, because we just can't right now. So I think that it was the better choice as far as the school districts in Sevier County. But I just wanted to be able to give somebody a straightforward answer and not something that I was not sure on. I was assuming that it was because of being smaller and easier to navigate, with more family participation in that school district than we see in DeQueen. So I just wanted to make sure that was the correct answer.
Well, and Jason has just been great because his team. So how they're stepping in to really support this is we said, nobody really knows what we're doing, right? Like out in the public, like we're trying to launch all these different prevention programs, all these different pilots. And so Jason and his team and Gavin are trying to do more media around this, right? So they have been, Jason, I think you interviewed already. Y'all had one interview. We're trying to capture kind of footage. I think next is with teachers to show the excitement, to show how they're building this as a team, because I'm getting really good feedback from teachers in these areas of like, this is an answer to prayers. We've been needing help. And so we're trying to build on that momentum and film some of it, so that we can tell the general public across Arkansas what we're doing. Because, you know, that's always our deficit, guys, of just getting the word out on things we are working on. So Jason's going to be an expert on these pilots by the time he's done with all this, because he's spending a lot of time interviewing people.
I'm kind of where Jennifer Brzee is. I'm in the early stages of learning everything, so far from an expert yet.
You're a quick learner. You'll do great. I think that, okay, so that is, and now just because Melissa said something makes me think of another thing, and then but is that not kind of the intention of the council as well, is to get out there and participate with our communities to understand what we could bring to the table and ask leadership? I just don't know if some people, now not knocking anybody, but I don't know if people understand that they can get out in the community and speak about what's going on within DHS and what Jason shares with us in these meetings. Just where, from my area where I'm at, I talk about it, and I do a lot of stuff across the whole state as far as speaking and stuff. And then I hear people down DHS. Of course, I have to come back and show, and I'm like, don't make them the bad guy. This stuff takes 5 years for DHS to legally do it, or something of that sort, which what I'm learning a lot of myself. I was one of those that thought it was cut and dry. We need this, let's do this. That is not how life works in the state. I'm learning. But I kind of thought that that's the idea of the council, is to get out in our communities and say, hey, this is what they're working on. This is where they're at. And then being able to kind of help Jason in that aspect to make sure that our areas are getting that information.
Yeah, you're exactly right. The goal of being a council member isn't to bring your individual issues, although we welcome those. It's not just to bring your individual issues to DHS leadership. It's to get out in your community, share what we share with you, and then share with us what the people in your community share. We work really hard to try to have geographical representation around the state, gender representation, race representation, disabilities, different abilities. We try to create this council where we're going to hear something from every segment of the populations in Arkansas that Medicaid and that DHS serves. So the more you can get out and meet with folks in your community and share with them what you're learning and share with us what you're learning from them, that's ideally the way this council would work.
Okay, that's okay. Thank you.
Any other questions for our DHS leadership? All right, I want to thank AFMC for facilitating this
I have one
virtual.
more.
Is there somebody? Angelica?
I have a question, Jason.
Sure. Go ahead.
Sorry. So I don't know really who this question would apply to. But looking back at the May 26th, the disaster relief response, I would like to know if there's any way that we can get communication out to individual clients versus like doing community outreach, because some of us, you know, barely got the information. Some of us did, like my neighbors did not get the information as to how to get that help. So I'm wondering if there's anything that can be done, like in communicating with the clients directly, or, you know, so that the information trickles down appropriately.
I think I can start and at least partially answer that question, specifically as it relates to Disaster SNAP. Disaster SNAP is approved by the Food and Nutrition Services in cases where there, you know, is a federal disaster declared and individual assistance is authorized. There are some criteria before FNS will approve it. And we did request approval and got approval for those storms and tornadoes in late May up in the northern part of the state. There were 8 counties that FNS approved us to do disaster SNAP. And there's really no way to do individual notification because we wouldn't even know everyone who might qualify for disaster SNAP. So we do broad announcements about those things. And that's what we did. And disaster SNAP is also for a short period of time. It's 7 days. And that's just the rule. FNS approves for 7 days to take those applications. Now, one other thing that we do during disaster times, or not even necessarily disaster, but if we know of storms and like widespread power outages, something new that we have started to do is send a reminder, and we do this individually to SNAP recipients because these are the only ones that we can do this for. So if you had a power outage or a storm, and this is even true if you have a house fire or something like that, and you lose food that you purchased with SNAP benefits, then you can request a replacement within 10 days of that, disaster, even individual household disaster happening. So when we become aware of things like that, long before we would even look at, is this disaster big enough to do a disaster SNAP application period, we have been sending notices to our active SNAP households that just remind them that you can request a replacement of benefits if you lost benefits or food because the power was out or you had a fire or things like that. So because people don't think about it just as an everyday thing, that's something that we can do for anyone, anytime there's an individual disaster that affects a SNAP household. So, and there are a lot, there are other benefits related to disaster assistance that come more from the federal level, from FEMA and others. And so I can't speak specifically to what their outreach requirements or campaigns may be, but I do think it's going to be similar to DSNAP, and they won't have any way of knowing who all might qualify or even need the assistance. And that's why you're going to see those messages around those things be very broad and trying to reach a wide audience because we can't really dial it in.
Well, my concern is that I live in a low-income housing with hundreds of other neighbors, which most of us didn't get the information because it was just like spread out through, like you said, broad channels like churches, which some of us don't attend to those churches, and like the local community agencies, like here would be Samaritan, which we weren't even out and about because, you only get the information if you happen to go to those establishments. But I was wondering, like, what happens to those other hundreds of people that don't get the memo? Because when I used to work for a nonprofit, IT had the ability to set up email blasts where we would send out mass emails directly. I know DHS identified there was 2 counties. It was cities, Decatur and Rogers, which is where I live. So they did know, they could narrow it down that way and identifying, the zip codes where we live because it was by zip codes. And just sending us like an email like, hey, during this week, you'll have the ability to come in and apply for disaster relief, because my upstairs neighbor, she's an elder, she's disabled. It was during the weekend where we had a heat advisory. There was no way she was going to get there, and there was no way I could take her either, give her a ride there. And I'm speaking just myself and my upstairs neighbor, not including like the other hundreds of neighbors that I have. So, I mean, is there any way we can get that as an agenda item? Like, I hope we don't have any other disasters, but not even for like even the food loss form. Like I got the food loss form 2 days before it was due. Then it was just working with the power company and trying to get that information. They said they needed a statement that they could only send directly. Well, I got it like on the 28th, which was 2 weeks after I needed it. So like that caused a hardship for a lot of people, not just myself, but hundreds of other, people that are really needy because, like I said, we live in low income housing. A lot of them are seniors, disabled, don't have, a vehicle or a way of getting there. So could we maybe get a heads up earlier on so that we could get, get the help that we need?
Angelica, did Noreen Pippin with Benton County contact you?
No, Aaron contacted me, but there wasn't really anything that he could do because he said that, the deadline had passed for me to submit the food loss form, which really he said that he had gotten the same response from the power company when they had contacted them trying to get the information for the power outage. And I don't know if it's because they were overwhelmed with, inquiries and just the response that they had to do on their end, but we couldn't get anywhere as far as just getting a statement of like, and then I come to find out afterwards by Aaron that I could have used the text messages that were sent by the power company stating, when the power outage happened and when it stopped. But even at that, like it was intermittent service for like the following 2 weeks. So we didn't have like a reliable food storage system. We just barely had enough to keep our apartment air conditioned. So we can just, a safe place to cool down.
What utility were you dealing with?
SWEPCO.
SWEPCO?
Yes.
Okay, so Mary, I don't know, just thinking out loud, maybe it's a case where we could reach out to some of the electricity providers and ask them what specific protocol they have in place for consumers following a natural disaster to get the forms that are required to qualify for some of this assistance.
Well, and that, that's a conversation we can attempt to have, for sure. But we have no mechanism and no way to know everyone's email address in a county or a city, because they're not all going to be on assistance. Everyone who needs help is not going to be someone that we work with on a daily basis. So we do have to do those broad announcements, and disaster SNAP is usually done pretty quickly upon approval of the disaster SNAP by FNS. But and we are usually and it usually doesn't come for like 6 weeks or more after the actual disaster, because it's disaster SNAP. Some of the requirements are that the roadways have to be open, the grocery stores have to be open and have supplies, because this is a food benefit. It's not actual food. It's benefits like SNAP benefits that you would purchase food from the grocery store. So it's part of disaster recovery more so than disaster response. But I definitely hear the feedback, and that and I can understand how it might be hard for some to know what's going on. And we can look additionally at potentially seeing if there are local city leadership, especially in the small towns. I mean, we definitely had communication with Rogers doing that, because they called us, asked what, will there be any benefits? Do you know when? So that they were aware and could also help broadcast the message. So we can at least take that feedback back and see if there are any other like bigger organizations or places that we can do outreach to help get the message out.
And I was gonna, I am asking specifically as a as a recipient. Like, you guys have my email address. I just verified it. I made sure it was updated on Access Arkansas. And I have gotten emails in the past. So what's stopping DHS if you guys have identified Rogers and Decatur are the cities, there are IT software programs that can help with sending out mass communications. It's just a matter of clicking a few buttons and an email gets sent out to those zip codes and to those people that are already receiving benefits, so that we're not in a hardship. And I'm just wondering, like is it is that feasible? Like, is it possible that, I mean, in a day and age of technology, like, I just feel like DHS is kind of behind on the communications aspect. It seems kind of almost archaic to have been told. I just felt kind of disappointed, being a MCVC member and being told by another. I just happened to find out by another friend of mine that's involved with the community. Just kind of like, I just barely was able to get the disaster assistance. But I mean, is that possible? Like, I mean, what other barriers? Because I just feel like you guys have, our email address, a way of communicating with us, and you guys did establish all of, the zip codes and all of that. So would it
So that is definitely something we can take back and take a look at the next time we're responding to a disaster. Obviously, SNAP recipients would not be the only ones who might qualify for those disaster benefits. But it is something that we can look at to see if there's a way we can do additional outreach individually to clients that we actually have in the SNAP program. So I appreciate that feedback.
Thank you. And I was going to add to that, like, I know the community partners like Samaritan do a good job about like posting information and like putting it out on the tables, but like, you won't know what information is out there unless you go in person. But is there any way, like, maybe they can assist with that, more direct communication with, the clients, and like outreach and that, and be more involved with that? Because they're already, as far as I know, they're already getting compensated for doing that, for participating in the outreach.
Well, I'm speaking only for disaster SNAP. There's no compensation, that has gone to like community organizations or anyone. We do share information, ask them to post it, ask them to share it with people that they come into contact with, but that's not a paid activity that we can fund for that. But I definitely hear your feedback. That is something that we can look at as we think about, responding to any future disasters.
Yeah, and I'm talking about more than just responding to disasters. I mean, I just submitted my recertification and I was told by Erin that it had been mailed out to me. Well, I believe on the 11th. Well, I haven't received anything. And I also haven't gotten any email saying, this was sent out to you. But I just think there's like a really big opportunity to use email communications to communicate with recipients. Because I do believe like us recipients, have, we've done the legwork, like we've requested assistance, other people. That might, so I just feel like we should be able to communicate better with DHS overall, and not just for disaster relief. I mean, I've yet to get the letter.
Well, and just as a reminder, and maybe you've already done this, out through our Access Arkansas Citizen Portal, you can sign up for email and text alerts for things like that. You can even opt into electronic notices rather than postal mailed notices. where we would send you an alert to either, by text or email to tell you you've got, mail from DHS, please log into your account and, read your mail. And so, I hear complaints about the US mail regularly, and we just default to that unless someone has specifically opted for us to do electronic communication. That's part of the requirements from the federal agencies that fund SNAP and Medicaid, that we send the regular paper mail unless someone opts into an alternative format. So, and again, it sounds like you might need some individual assistance. And if you would like me to, I can connect you to someone if you want to check on those alerts and things in your
Yeah.
Access Arkansas account.
I was gonna say, is it one or the other? Like, do you have to, by opting into text message and email alerts, are you opting out? I think that's why I didn't do it, because I thought if I did that, I was gonna opt out of the papers, the paper letters and notices, and I still want to get those because I'm a visual person, and like I like having something in paper where I could see it, like put it on my fridge or like as a reminder. And so I don't know, like whenever I did verify my email, I did put email and text alerts, but so far I haven't got a single text or email.
Okay. Well, let me get someone to communicate directly with you about those questions outside of this meeting. But you can sign up for the alerts without turning off your paper mail. I believe
that's what I thought I did.
Specifically opt into electronic notices. But let me get someone to communicate with you from my team that can help you with those individual things.
Okay, thank you. I appreciate
Erica, I see your hands raised. Did you have a question?
Sorry, I just had a really quick comment. So one of the things that really will help on the help DHS, if you or a family member or a friend, anybody in your community that you know has a disability, whether it's visible or invisible, if they will alert their electric, their water, their gas companies that they have a disability in that household, they are put on a priority list to have electric turned back on, water turned back on. They will work with you if you can't pay your water bill right then, all of these things. And that will help DHS be able to help. Also, like Mary said, the town, the city of Rogers had reached out to them. Rogers would have posted all of that information on their social media, City of Rogers, so you can just go right there. So just make sure you're connected on social media to both your city, and then also make sure you're doing your part as far as your utilities, and letting them know, because you go right to the top when there is something like that, the tornadoes that did hit up here in Northwest Arkansas. So, and that's something that will help DHS, because the electric company will give you a number immediately. And you also have your text messages that will come to you, and you can give that to DHS ASAP, immediately, while you're on the phone with them, and they can help you just in a snap. So that's just a comment. And I work a lot with the Independent Living Council, so I know this part of it, but I just really urge those individuals to do your part on that end as far as utilities and connecting with your city on social media, because they send out alerts all the time. Thank you.
Thank you, Erica. Any other comments or questions from leadership or from the council? All right, hearing none, the next meeting, the third Tuesday in September, is the 17th. That hasn't been firmly set as our next gathering point or time. I have to check with leadership and council members to make sure it works for the majority of folks, but Tuesday, December 17th is a tentative date for our next meeting. It will be in person at AFMC, and we look forward to seeing you all there. Thanks for signing on today, and enjoy the rest of your week.
Awesome. Have a great summer, guys. Bye.
Bye-bye.